In this video, I'm going to be explaining about emotional preparation for preoperative patients. So what is the definition of preoperative care? It is basically the preparation and management of a patient prior to surgery. And this care includes physical and psychological preparation. So what is the purpose for emotional preparation? Patients who are physically and psychologically prepared for surgery tend to have better outcomes after surgery. Preoperative teaching meets the patient's needs for information regarding the surgical experience, which in turn may alleviate most fears the patient has. Knowing what to expect after the surgery and enlisting the patient's input about goals and expectations often helps the patient cope better with post-operative pain and decreased mobility. Patients are often fearful or anxious about having surgery. Healthcare workers can help decrease anxiety by listening to the patient's concerns, validating their legitimacy, and answering the patient's questions honestly. This responsiveness can be especially beneficial for patients who are critically ill or who are having a high-risk procedure. The family needs to be included in psychological preoperative care as much as the patient. In the hospital, pastoral care can be offered. If the patient expresses a fear of dying during surgery, this concern should not be discounted. The surgeon should be notified. In some cases, the procedure may be postponed until the patient feels more secure. Children may be especially more fearful than adults. They should be allowed to have a parent with them as much as possible, as long as the patient is not demonstrably fearful and contributing to the child's apprehension. Children should also be encouraged to bring a favorite toy or blanket with them on the day of surgery. Lastly, preparing the patient and family psychologically helps them cope better with the patient's post-operative course. Preparation leads to the superior outcomes since the goals of recovery are known ahead of time and the patient is able to manage post-operative pain more effectively. Thank you.